Hello again, I'm Dr. Roland Caire and welcome to another episode of ToothsDay Truths, where I answer your questions on dental care based on over 40 years of experience. If you're enjoying these videos, please take a moment to subscribe down below. The guest I had planned for today turned out to be a deadbeat, and the need to replace him hung like a dead weight on my shoulders. I realized I was deadlocked with a deadline looming, so I deadlocked my front door and deadened my wall so I could concentrate with a dead eye on finding a new guest. Then I remembered this dead guy, so I asked you to welcome my deadpan friend, Mr. Bony Maloney. Bony, how you doing?
Gee, Doc, you are deadly with a thesaurus. But I got a question for you. You see, my dentist says I need to get a tooth pulled, and he says I need to get a bone graft where the tooth is taken out. Now, why is that?
Well, not every tooth that's removed needs a bone graft placed afterwards, but it's often a good idea. Let me explain why. You see, when a tooth is taken out, it leaves a socket or hole in the jawbone. Normally, that hole fills up with blood, forms a clot, then your body replaces that clot with bone particles and fills in the hole. But the system isn't perfect, and your body doesn't rebuild the same structure you had before. In most cases, when the jawbone heals, it leaves a curved shape at the top. At least, that's what it looks like when viewed from the cheek side of your tooth. If you look at the same area from the tooth in front or behind the socket, the bone loss usually appears much worse, often developing a kind of mountain peak formation. This is important when it comes time to replace that tooth. This mountain peak bone formation makes it difficult to wear a denture or partial denture comfortably. Likewise, a fake tooth held in by a fixed or permanent bridge won't adapt well to the bony crest. And finally, if the tooth is to be replaced with an implant, the implant will have to be placed much deeper into the jawbone to make sure the implant is completely covered with bone. In fact, it was this problem with implants that really pushed along the development of modern bone graft techniques. But dentists soon discovered that bone grafts made all types of tooth replacements more successful.
Wow! So, how are bone grafts done anyway?
Well, in most cases, when the tooth is removed, the socket is cleaned, and then the bone graft material is pressed into the socket, covered, and held in place with a stitch or two. Then, in about 3 months, the bone is sturdy enough to place an implant, or some of the other tooth replacements can be done even sooner.
Man, that's cool. So, what's this bone graft material made of anyway?
Well, there are many different options. Sometimes the dentist can even take pieces of bone from other parts of your body. But in most cases, your dentist will probably use a commercially available bone product. Those come from a variety of sources, including inorganic compounds, ligaments and bone from certain animals, and even human skeleton bone.
What? Skeleton bone? Man, I could have gone the rest of eternity without hearing that. But if I get this bone graft, could I be walking around with some other skeleton's bone inside of me for the rest of my life? Or, in my case, the rest of my death?
No, you see, whatever bone graft material is used, your body gradually eats it away and replaces it with your own bone. It just uses the bone graft as a kind of blueprint for building your bone back correctly.
Well, I guess that's better. But I'm still going to have to keep looking over my shoulder in case somebody wants to use me for bone graft material someday. Thanks for the talk, Doc. I think I'm going into hiding. So long.
So long, Boney. Remember, the information I provide should only be used as a guide and is no substitute for a visit to your dentist. If you have any other questions you'd like me to answer, you can reach me at rcaredds at Facebook, Instagram, Twitter, and TikTok, or you can email me at rcaredds@gmail.com. And please remember to like, follow, share, and subscribe. It really makes a difference. See you next ToothsDay.